Hello, everyone. Welcome to our first episode of Fertility Insights series presented by Femcare360, a startup focused on providing holistic care. In this series, we explore all the things related to reproductive health and fertility. Today, we are delving into a crucial topic, unlocking the secrets of fertility supplements. Joining with us is Dr. Priyanka Kesharwani, a gynec and a fertility specialist with years of experience in this field. Welcome, Dr. Priyanka, and thanks for taking out time for us today.
Thank you so much, Shravanti. Thank you so much for the warm welcome. Hi, guys. I am Dr. Priyanka. I'm a consultant gynecologist and a fertility specialist. Here, we both are creating a platform so that we can, provide the services at ease for each of the females or the youngsters around us. So I think we should start today with the session.
Sure. Let's kick things off with basics, shall we? Dr. Priyanka, yes. What exactly are fertility supplements and why are they so important?
Well, fertility supplements, just unlike the nutritional supplements, these are required in certain desired amounts. Now, they are given in addition to our diet that we consume. Now, it is important both for males and females. However, for females, it counts to be a little more of importance because obviously in future, they are the ones who are going to bear the pregnancies. Now, your fertility supplements can be anything in a combination of vitamins, minerals, and herbs that enhances your reproductive health, or so they claim. So, also, if supplements, they are found to be very beneficial, but if they are not taken in the recommended dosages or from the correct source, it could be either ineffective or it could be harmful for the public.
So the key is the correct amount and the correct source of these supplements. How exactly do these supplements enhance reproductive health?
See, these supplements are just one piece of a fertility puzzle. So apart from taking the fertility supplements, it is very essential for an individual to maintain their daily healthy lifestyles. They should take the balanced nutrition, they should regularly exercise, and extremely important is to manage their stress, to optimize their fertility, to optimize their reproductive health. And that might not be sufficient to provide, in the nutritional diet. So we just supplement ourselves with those fertility supplements.
Sure, that's enlightening. It is clear that holistic care is vital, not just for fertility and overall well-being. And supplements are one of the key pillars in this fertility holistic care. Dive into some of these important supplements. Doctor, could you walk us through what are the important vitamins and minerals that are particularly helpful for fertility?
See, the list is innumerable. Like I can start counting on them, and there may be endless list of it. But just to start our conversation with, folic acid, or what you call also as vitamin B9, is very, very essential, not only for the ones who are, suffering from infertility, but also from the ones who are going to plan their pregnancy. So folic acid is very essential, and it is very essential because it is one magic medicine or supplement which is required in order to prevent neural tube defects in the coming pregnancies. So it should be taken in the recommended dosages. The daily requirement of the folic acid is around 400 microgram, and it should be taken on a daily basis. Someone who is planning conception should start taking it from 1 to 2 months prior, and that way it is very going to be helpful for the future pregnancy.
Sure, thank you. critical vitamins like vitamin C, D, and E, and how do they contribute to reproductive health?
As so we've heard enough, like vitamin C and vitamin E these are counted as a very powerful antioxidants. So these antioxidants are very important, not just to maintain the regular, the structure of a human being, but apart from that, these are the ones which prevent the damage, which we call as the free radical damage, which we've been hearing all these days over the Google also. So they are trying to protect the oxidative stress to our cells. That way, they prevent the damage that keeps happening because of our ill habits or pollution or the lifestyle that we have adopted. So they prevent from that. And hence, it maintains the the life strength of those eggs and the sperm qualities. So it's very essential. However, if we talk about vitamin D, of course, again, is very essential. Just as a nutritional supplement, it is required. It's read in studies like, vitamin deficiency of vitamin D can often lead to pregnancy losses, or it can lead to, a failed pregnancy. So, however, although there are no claimed effects of it, but yes, one must take vitamin D in their daily supplements.
Right. Thank you for that comprehensive overview. What is the contribution of other important nutrients like B complex, vitamin, iron, and omega-3 fatty acids?
The other vitamins that are very essential, like vitamin B6 and B12, now these are the ones which can be contributing eventually to anemia. Now, these are not the ordinary anemia which we talk about, that is the iron deficiency anemia, but they do lead, their deficiency definitely leads to an anemia, and that can be contributory to pregnancy loss. So yes, we need to focus on our correction of the iron levels in our body and as well as the vitamin B complex in our body, because these deficiencies of these two can eventually lead to pregnancy losses, failed pregnancies, infertility, and hence maintaining their on the regular basis in our diet is very essential. Someone who's consuming a non-vegetarian diet definitely gets them through the diet itself. However, due to the the lifestyles we opt, like being a vegan or being a vegetarian, yes, that does not suffice the enough amount of iron that is required in our body, and hence it needs to be supplemented through these fertility supplements. So if anybody is suffering from anemia, it is obviously recommended for them to correct their anemia prior to planning a pregnancy. Now, omega-3 fatty acids, equally, these are those small micro level of, nutrients that is required to maintain the health of the egg in the case of females and sperm quality in males. So they are required in a very micro level. And hence, if it is not even known, to the dietary sources we can obtain from, we can definitely supply them through our fertility supplements.
All right. That's a good insight. Get the particular micronutrient from our regular diet. It's essential to aid it with the supplement medication. Doctor, I hear about this buzzword CoQ10, which claims to be very beneficial for fertility. Could you give a brief introduction to what is this CoQ10?
Well, if you're going through a fertility journey and you've not heard about CoQ, well, I don't think so that's happening these days, because it's the most common doubt I hear amongst the patients asking me directly, sir, madam ji, hame please CoQ enzyme jisme hai, uski medicine dijiye. Well, that is very important, and it's gaining its attention because it is one of the most powerful antioxidants which prevent the damage. Again, so antioxidant has its role in preventing the damage to the eggs and to the sperm. So it is very essential again, and it has found to be remarkably changing the quality of sperm from someone who had a low quality sperm, or the damaged morphology or the structure of the sperms has found to be changed by consumption of CoQ. Well, the benefits of CoQ is really long. Now, as someone who wants to really understand the science behind of CoQ working into our bodies, it's better that we make a separate video and make people aware about it, because I don't think so I can stop here, because there's lots to talk about CoQ, but it is very essential. And definitely, once you go to your fertility practice specialist or a gynecologist, you must ask them to provide you, if you're going through a fertility journey, definitely they are going to prescribe you on their own.
Sure, that's good to hear. We will definitely look forward to learning more about CoQ10 in our upcoming episodes with you, Doctor. Any other supplements in addition to the critical ones which we have discussed so far?
Well, there's one thing which I think I forgot to mention, and that's myoinositol. Now, this is also again gaining a lot of importance amongst the females, young females who are suffering from PCOS, and yes, it has certainly a very major role, because see, normally what are myoinositol or D-chiro-inositol? So inositols are generally generated in our bodies. Now, in certain females, there is a deficiency. So obviously, and those deficiencies are generally found under the females who are suffering from PCOS. So supplementing it through the supplements or the fertility supplements actually aids in providing one thing. Of course, it helps in ovulation. Now, ovulation is a condition, is a general thing. I think every female knows about. Every month you release an egg. That's what you call as an ovulation. In a very layman term, I've explained. So, if you do not have the certain levels of enzymes, or the hormonal balance is not correct, it can lead to an anovulation, or you can say the irregular menses, which can represent into irregular menses. So in PCOS, this is exactly what happens. Someone is suffering from PCOS knows that really well, that their menses are a little irregular. Although this is not the only criteria to describe what PCOS is, but this is one of the simple explanation what general public has. So maintaining the levels of inositol definitely helps in maintaining their regular menstrual cycles. Apart from that, it also helps in the fertility journey with someone who's planning to conceive.
So, can you provide some guidance on choosing the right supplementation regimen and when to seek medical advice?
Well, for that, firstly, I would like to say, when you're going through a fertility journey, I know it is very difficult, but being patient is the most important key. And especially, because it's very tedious and it's very stressful once you're planning a pregnancy. So being patient about it is really very essential. And when you are taking fertility supplement that is actually prescribed by your doctor, gynecologist, or fertility specialist, please give some time for its actions, because it is not going to happen overnight. It's present in our body in micro levels. It's going to act in a level of at micro levels. It's going to take time for its action to give you enough results. So and I cannot say that I have given you last patient got its results in 3 months, you will get also in the similar period of time. No, it takes time. It varies from person to person. And it may sometimes take 3 months, sometimes it may take 6 months. If the damage is nothing, then it might give you good effects. But if the damage has been done previously by our own lifestyles, by our own opted choices, we may not even see a result. So all I say is just give its own sweet time. You may understand. Now, when you pick a fertility supplement, you must understand there is something called as combination formulas. Now, I've enlisted you around 12 supplements, 13 supplements, which are essential. You can't pick each of them and start popping 12 tablets in a day. You'll require them at micro levels. So if there are supplements which combine and give you combination formulas where they have all the supplements in micro levels combined all together and provided to you, but in the right proportion. Now, I mentioned that each of these fertility nutrition that I spoke about is in micro levels, and that needs to be combined. But a desired level is definitely required. So when you choose that, you should be aware that each nutrition has its own requirement, and that is different for every individual. So you must ask your doctor before opting for any random fertility supplements. So I think that is going to make a lot of difference.
Very well said, doctor. Every individual is different. So is their nutrient intake, and also give it time to get benefit from the your supplementation intake. Can you name one or two key vitamins one should include in their routine right away?
Well, apart from mentioning the two most important vitamins that is required, I will first like to focus on three things. It's like, please maintain a balanced life, healthy lifestyle, maintain a balanced diet, and of course, try to reduce your stress or go for stress management prior to opting for any fertility supplements, because these three things are really very essential. But apart from that, if Shravanti has asked me this question, I will answer only with two supplements, which is very essential. Well, first is folic acid. It's very important. And now that I have already spoken about CoQ enzymes, those are also very essential. Wouldn't withhold anybody taking these if they want to.
Key takeaways from today's discussion, doctor. Number one, fertility supplements are nothing but formulations of vitamins, minerals, and antioxidants or herbs to support reproductive health and enhance fertility in both women and men. These supplements work by providing essential nutrients that promotes at various levels like hormone regulation, be it enhance or combating oxidative distress, and thus helping overall reproductive health. Second, the two key vitamins to consider incorporating in one's diet is folic acid and CoQ10. CoQ10 is a powerful antioxidant which may improve quality of egg and sperm and protect cells from oxidative distress. And the next is holistic care is very critical for fertility health, and supplements play a critical role in this care. And finally, consult with a medical professional before adding any new supplement to your routine to ensure that they are appropriate for you. It has been a pleasure having you on this show.
Thank you so much, Avanti, for giving me a platform where I can speak about all this. Thank you so much.
Our listeners, thank you for tuning in to this informative discussion on supplements and fertility. Remember, you are not alone on your fertility journey. We are here to support you in every step of the way. Be sure to explore Femcare360 services by clicking on the link in the description below. Also, please like, comment, and subscribe to our channel. Stay tuned for more episodes of Fertility Insights, where we continue to explore all the topics related to fertility, health, and reproductive health. Until next time, this is Shravanti from Femcare, wishing you all the best for your fertility journey. Take care and stay healthy.